Jay, correct me if I'm wrong, but you did see some troubling signs when you look at the data. So let me put up for everybody, there's this thing called the calcium score. If you have high cholesterol, your doctor sometimes encourages you to get a calcium score to see if the plaque is already building up in your arteries. So in 2009, the president's calcium score before he was president was 34. In 2013, before he was president, it was 98. Today, it's 133. And as you see from the little cheat sheet fine print below, a score of over 100 means a high risk of heart attack or heart disease within 3 to 5 years. What do you make of these findings?
Well, I mean, that's concerning. I mean, I agree with Dr. O'Connor on this point, that you want to take patients at this point in time. And I think what Dr. Jackson was saying yesterday in the White House was we've assessed the function of President Trump's heart. They did an echocardiogram, they did a stress test, and there was not cause for concern there. But when you look at the findings you just put up there, Allison, this coronary calcium score is a score that a lot of cardiologists use to try and be predictive and be proactive. And if the number gets up over 100, that is concerning to a lot of doctors. It's concerning because you can start to say, well, if you do nothing different, if things don't change, you can start to predict the likelihood of having some sort of heart event, cardiac event, a heart attack or something like that within a certain number of years. And you see the trajectory of President Trump's numbers, no doubt, and I think Dr. Jackson alluded to this, because of his diet and because of his lack of exercise, that would be part of the reason those numbers have likely gone up. And they have continued to go up despite the fact that he's been on medications. So the president has heart disease. Those numbers qualify him for having heart disease, and it clearly needs a plan to try and prevent some sort of heart problem down the road.